admit everybody. All right, here we go. Hi, everybody, and welcome to our webinar, Mapping Mental Health. So excited to have everybody here today to talk a little bit about the things that we can learn from the experts at Woods Homes around sort of recognizing when it's time to get some help for the people that we notice are having some struggles, and how to navigate that. I'm Nicole Dunstan, and I am the communications manager at Woods Homes, and I'm really excited that you're here. This is kind of a first of its kind for us here at Woods Homes in terms of educational webinar. It's my pleasure to introduce to you our speakers for today. We have a really exciting mix of clinicians, and I'm just going to read a little bit about them for you. First of all, we have Cameron Kopek. He's been with Woods Homes for 21 years. And in that time, he's supported children and families as a youth and family counselor, a team leader, supervisor, and now he's a senior clinician. So I'm really excited that we have Chris with us, or Cameron with us, sorry. Chris is with us also, and he's a registered clinical social worker with a master's degree, and he's been working in this area for over 25 years. So welcome, Chris. And last but not least, we have Laura Volcano. Great last name. Laura's been with us as a long time. Her background is in psychology. She graduated from Winnipeg and is currently supporting individual families through our Eastside Community Mental Health Services as a crisis counselor. And she also coordinates the counselors there. So very exciting to have all of you with us. Thank you so much for joining us.
Thank you. Thanks, Nicole.
A little bit of housekeeping. We are recording and we do plan to post this webinar. So if you do plan to be asking any questions that you feel like you would like to be maintain personal privacy, please feel free to change your name in the option to change your name. You can just click on your name in your square, and it will allow you to edit it if you would rather have just a first name. In terms of questions, please feel free to enter questions in the Q&A rather than the chat. And in the Q&A, you can also vote people's questions up if it's the same as yours rather than repeating questions. So we would really welcome you to put any questions that you have into the Q&A sort of as we're talking. And then we'll also do a dedicated question and answer period at the end. All righty. So I'd really like to get the first part of this conversation as Chris and Cameron and Laura, when you were all talking, you were talking about how it's kind of hard to talk about mental health unless we really define what that means to us as clinicians and service providers. So how would you define mental health? Why don't we start with you, Chris?
So I think when people experience stressors in their life, um, that tends to trigger certain mental health warning signs. And I think it's good to have a good baseline or gauge or understanding of what normal, good, healthy mental health looks like so that you can kind of give yourself a comparison to know when you're a little bit feeling off center from that. And because I think people have, a lot of stress and distress in their life that accumulates over time from multiple factors, work, children, family life, um, internal stressors, external stressors. I think stress is a phenomena that we all encounter and try and get a handle on and manage. And sometimes that works better than other times. And when that sort of falls apart, it's good to understand, where's the underlying cause? What's the root cause? And sort of how do we manage that impact?
Thanks. What would you like to add to that, Cameron and Laura?
Yeah, I think I would just add that, mental health can be thought of as a state of our psychological and emotional well-being that is connected to and as important as our physical health.
I think that mental health is like you have a window of tolerance that life stressors assail you, but if you can kind of manage them, you're kind of inside of this sweet zone, right in the middle. And if too many things are happening in your life that are causing stress, anxiety, and other things, you can come outside of that window. And if you stay there for too long, you're just having a lot of trouble dealing with day-to-day stuff. Then maybe little things that you were better able to manage a month ago or whenever become more unmanageable. Um, yeah, it gets quite difficult to see. So when you're inside a window of tolerance that you're comfortable in being, that's probably when you're in the ideal state of mental health. And when you're not so healthy.
Thank you so much. It really is all relative, isn't it, to your own personal sort of normal health. Okay. Uh, Curious about what you're seeing. And I think we would all kind of like to know, what are you seeing right now in the young people that you're serving in the community in terms of mental health challenges? Help us all kind of understand what the common things are.
So I think in the age of social media, I think young people, adolescents in particular, and even children are bombarded by social media, excessive screen time, um, in some cases, lack of nutrition, lack of physical exercise, lack of engagement with family, with peers, sometimes having poor peer relations that adds distress to their life. And so I think young people, by and large, are bombarded by multiple factors that create cumulative stress. And I mean, I mean, from a mental health perspective, you could look as early back as sort of childhood when people develop what we call toxic stress related to adverse childhood experiences or trauma that can accumulate over time. And that can lead to significant complex mental health and specific diagnosis. So that's the kind of extreme case. But I think generally in terms of your question, um, everyone's bombarded by social phenomena and social forces. And so it really is trying to figure out what is your lifestyle management plan. So how are you going to manage your life in a way that makes sense for you and your family and is going to keep you focused, centered, clear of mind, emotionally regulated, um, balanced, and all those things.
Laura, what do you think around, or Cameron, sorry, what do you think around this area? Are you noticing some specific things in the work that you're doing?
Sure. The area I work in is exclusively with young people, teenagers. In the long, long ago, when I was young, you would go to school and you would either have the telephone or what you would encounter in person. And this is where you would have to construct what do I know, what's true, what isn't, etc. And as Chris wisely pointed out, in this era, especially with teenagers and people becoming teenagers, there's so many more spheres that they have to navigate all this data and decide what is real, what isn't. Is that a rumor? Is that something I need to fact check? And that extends far beyond even just themselves, their school, but it also extends into their community and worldwide, really. And since we do understand that the internet is not necessarily a very truthful place, there's a lot of misinformation that a lot of teenagers can get caught up into and absorbed into. And all of this is especially concerning for a lot of parents because oftentimes their teenagers are diving into this stuff far outside of the supervision of, a parent or a guardian or someone who's looking after them.
Um, Laura, what would you like to add around in your crisis counseling people are coming to you with around mental health?
Yeah, so I would say that most lately we've been seeing an increase with concerns around school anxiety and social anxiety. So whether that looks like refusing to go to school or not wanting to go outside and leave the house in general.
Hmm. Okay. So, taking a look at the next kind of way we were hoping to go with this conversation, I'm just wondering a little bit about help people out in terms of understanding uh, when it's time to get help. You've noticed that there's been some changes in someone that you work with, someone that you are raising, a family member, friend. You've noticed that their behaviors changed from what their kind of normal state of being is. How long is too long to wait before you sort of bring that awkward conversation up?
Hmm. Well, if I think back to what I had said originally about we all exist within a window of tolerance. If you know someone well, whether that's your child, your coworker, your friend, etc., if you notice that there's too much of something in a particular lifestyle change or way of being, or too little of something. Someone that used to have a very ritualistic way of going about their week, like a coworker, and you notice that they're communicating with other people less. They're avoiding the lunchroom. Your child is avoiding social contact, that they come home and they're not wanting to go out or speak with their friends. And if you notice this over a period of even a few days, that would be worth it to at least check in with that person. I think you don't necessarily have to jump to an extreme intervention, but something outside of the ordinary that from someone you know, and love, and care about. Um, yeah, if you notice that pattern occurring for more than a few days, you should at least ask about that.
Great point.
So what we know statistically is anxiety and depression, signs and symptoms of anxiety and depression often occur within adolescents and adults alike. And some of those telltale signs are social isolation, withdrawal, disengagement, disconnection from family life, excessive worries, lack of energy, lack of concentration. Um, and I think one of the most significant contributors to poor mental health is lack of sleep. So there's a lot of information on YouTube and in the internet about the importance of sleep hygiene, proper sleep management protocols to ensure, and there's a good reason for that because it is a significant causal factor for things like self-harm, suicidal ideation. There's a direct associative link between lack of sleep or poor sleep and higher risk and also mental health symptoms. And I think social media is only exacerbating that problem, making it even more prevalent amongst young people. Like it's not unusual for me to hear a young person staying up anywhere between up until 3 to 5 in the morning on their cell phones with complete access to the internet with no regulation, no supervision, no sort of vigilant care about what they're doing, and that can cause a whole myriad of problems beyond the physical health alone.
Okay. Lara, what would you like to add to that?
Um, just kind of echoing what my colleagues have already said. if we're thinking about when is the right time to talk to someone, if we're noticing things, I would just echo, as soon as even just a few days, right? If something is up, if you're noticing changes in their routines, I said behavioral changes impacting quality of life. So they're not engaging in things they used to, they're isolating themselves, they're not wanting to socialize, changes in sleep and eating routines, changes in hygiene routines, not really putting in that effort to take care of themselves as they used to, right? Just I think the key here is changes, like in what was the norm or the usual and what you were seeing before, as well as changes in mood, or kind of expressed thoughts about like a negative view of self or a negative view of things.
Okay, appreciate that. Uh,
Yeah.
how do you start that conversation?
Well, I think there's
I
a, you know,
sorry,
I think there's
go
a,
ahead, Chris.
I think there's a tendency in families to not have any sort of conversation. There's not a lot being shared or expressed or discussed. And I think that's where you start. It's like getting a family conversation going between parents and young people, between adults, themselves. I think getting the dialogue, having open, honest, upfront conversation, and it doesn't have to be heavy topics. It can be light, but it's the idea is to connect and to attach and to share experiences and get information on the table that you can be aware of and work with, because a lot of mental health goes underground, it goes silent. And when people are struggling and they're suffering in silence, and it's a lack of dialogue and conversation that could be contributing to where a lot of problems could be easily alleviated or resolved just through simple conversation. So it really is about connection and conversation and sharing amongst family members, and that's not just between a few family members, that's between the whole family, getting the whole family engaged and activated, and sharing is critically important.
Laura, Cameron, what other pointers can you give people about how to address their concerns and worries for their loved one?
Go ahead, Laura.
Sure, thanks, Cameron. So I would just suggest, like as Chris noted, opening up a dialogue with the young person or the person that you're concerned about. And so that looks like choosing a good time to talk, not one where you're feeling rushed or they might be feeling rushed or stressed. So choosing a time when you have enough time and you're feeling ready and regulated to have that conversation. And if either party is becoming escalated or things aren't looking as planned, then I would suggest taking a break and rescheduling the time to talk, because choosing the right time is really important so that they are present and willing to participate in the conversation, and the things that you talk about are actually going to stick in the other person's mind, right? And when we get too escalated, we aren't going to be thinking about those things clearly or remembering everything that was said. And so approaching the young person or the person that you're concerned about with kindness, and really managing your own affect in those moments. So when we talk about managing affect, it's just being mindful about how we're presenting ourselves, the tone of our voice, the expression on our face. All of those things are important to be mindful of in the moment, and presenting ourselves in a kind and open and non-judgmental way so that the other person is going to feel comfortable having this conversation and opening up to us about something that might be difficult to talk about. So along with that, just being curious, being empathetic, and as I mentioned, withholding our own judgment or kind of putting our own feelings and our own self aside and really tuning into what the other person has to say. And so another important piece is letting them know that we're there for them and we're going to be supporting them and getting the help that they need, whatever that might look like, and involving them in the process of that. So, I guess the message would be, we're not making decisions for you. We want to hear from you about this so that we can make decisions together, and, giving them that sense of efficacy, and it'll increase the likelihood that they want to participate in this and have this conversation and look for options together. Um, and avoiding making, we would like to say it's about making I statements and avoiding you statements. So a good way to think about that is, when we're saying something to someone and we're saying, well, you do this or you do that, it tends to kind of put the other person on guard or feel like they're in a position where they need to defend themselves or resist what's happening. Whereas if we are coming from a place of empathy and we're phrasing things using so I statements. So an example could be, I've noticed A, B, and C, and because of that, I've been concerned about you. Or, so being mindful of kind of reframing our language into I statements to already lower the chances of the other person responding in a defensive manner.
Cameron, I'm curious to know, once you've broken the ice, what are the next steps? What are the first steps that you take when you're seeking help alongside somebody?
Well, thank you, Laura. I should have written notes down there. That was a lot of great stuff. Um, I like to encourage families in particular, but this would work with adults too, to just start with an invitation. So you've started a dialogue, and giving an invitation like, I am here. If there is anything that you'd like to tell me, you know, let's talk about it together, versus trying to prescribe something to a friend or someone that you care about. Well, I think you should do this, and I think you should do that. Like encouraging people to, as Laura said, have control over their own choices. Just noting with those I statements, like, I've noticed this. I've noticed you're not your kind of usual self, and I'm just worried and concerned. And I want you to know that, if there is anything that I can do to support, I am here for that. It's a very non-threatening sort of way of going about that. That's like an initial reaction. Obviously, Laura alluded to, if you've noticed something for a long, long time, and those conversations might get heated and then not heated and then heated. But if you're bringing it up for the very first time, it's a lot less intimidating. Let's say if it's a parent to a child saying, "Well, I noticed that something's not right. Like, we should be going to therapy. Let's go talk to someone. Come on, let's go." And you might be inviting that defensive reaction versus allowing that person to come to the conclusion of, yeah, maybe I should. That might not work, in which case you might have to have continued conversations, as Laura has mentioned, and you might have to take a more of a stance on that. But at least initially, try not to make the decisions for the person. Just let them know that you're an ally with them.
And, that kind of brings us to this next big question that people have, which is, where do I start in terms of navigating the system for actual help? I know one of the things that kind of spearheaded the whole topic for today is, boy, it's really hard to know where to start in terms of getting some help. So, how do people start to get support? Where do they look? What are the avenues in?
I would suggest as a starting point to take a look at your local community resources and supports. What do you have around you in your immediate environment that you can leverage? Is there a recreational program, a group that you can join, something less intensive to begin with, and see if that makes any difference to the current situation. Then if things become more intensive, then I would start sort of going up the ladder towards other resources like, okay, do we need to go for a single session of family counseling just to put some issues on the table for discussion? In which case, Woods Homes has, a counseling service that's no cost, no fee to families. That doesn't mean it doesn't cost anything. It just means that there's no charge for that counseling service. And that's a single session counseling service, Eastside Community Mental Health Services. So that would be that sort of one entry point that people could access. But I would strongly encourage people to try some social community connections first before they jump into more intensive supports, because they might find that that's enough to get certain things resolved and focused and a bit of relief in their life. But there's a whole range of services, and I guess it's according to intensity of what's required.
Can you tell us more about that in terms of, rather than jumping straight to the hospital emergency room or into crisis counseling, what are some of the community
So,
resources?
so if you have excessive worries, for example, or you're feeling a lack of energy, it might be worthwhile talking to your doctor about, you know, about your lifestyle and getting a blood test and getting a baseline for your physical health and talking about your sleep routine and sort of do a little bit of investigative detective work on that side. And if things look like they're more complicated, then your doctor might refer you to a counselor to look into signs and symptoms of depression or anxiety. If that something more complex is at work, like ADHD or other complex mental health presentations, then you can look at more specialized programs and psychiatric support. But I think it's kind of like a step-by-step process. And whatever you can do for yourself to take charge of certain distress is is in the long run a more proactive, better measure. But when you feel like it's beyond your capacity, then it's having that courage and that wherewithal to reach out and ask for help. And it's helpful to be specific about what kind of help you need, like writing down some observations for your doctor about what you're noticing, right? Like I have a low energy, I have lack of concentration, I can't stay focused, I'm worrying all the time, I'm isolating in my room. Those are things you could present to your doctor as a offering so that they could help support you and move you in the right direction.
Mhm.
Could I just add, make sure that your doctor's last name isn't Google, because that's not actually going to help you, unfortunately. And I think a lot of people will be drawn to the internet first to look up some things, and there's definitely information that's accurate, and there's almost equal amounts of information that's inaccurate. So, family doctor is a good choice. Um, in my line of work, I'm pretty knee deep in people who have been dealing with various systems for years and years. And what most parents would tell me, and I can confirm is true, is that there are many more people who need services than services that are available to people, especially in the field of mental health. And it can be incredibly frustrating. And a lot of parents will share that you need good advocacy skills. You need people alongside you that actually understand the various systems involved. Unfortunately, within the public sector, you do get a lot of hot potato where one sort of system might say, yeah, maybe not us, but try them. And a lot of parents express real tangible frustrations that they feel like they get bounced around between several different care providers before or even if they are able to access the correct services. It's a maze. I was going to say it's a bit of a maze. No, it's not a bit of a maze. It's an actual maze. It's very difficult. And if you need support and allyship in that, there are people you can definitely reach out to that can help navigate those things because it's complex.
Laura, do you have any tips or tricks for folks that, have been trying to navigate resource finding and just feel a bit bounced around?
Yeah, for sure. I'll mention that Alberta 211 is one of the resources that sometimes we refer people to. They're a place that you can call to just explore resources for yourself. But another good one is actually a program that we have here, our service that we offer here at Eastside Community Mental Health Services. So we do offer free system navigation support through our program as well. So our crisis counselors are available from 8 a.m. to 11 p.m. on our phone line for crisis support, but we also do support people who are looking for resources as well. So you can always give us a call, and this number is probably going to be shared somewhere, but I'll mention it's 403 299 9699. And that's our number for both crisis calls and system navigation support. Because, yeah, we do get a lot of calls from people who are, yeah, they're reaching out for the first time, or maybe like that's been mentioned already, people who are getting bounced around and feeling frustrated. So we're a support in those moments for people.
Yeah,
Yeah,
and anybody who, oh, sorry, go ahead, Chris.
another significant service we utilize is Access Mental Health. They have access to a variety of mental health areas, including grief and loss, groups, individual work, diagnosis, like you name it. They pretty much cover the wide spectrum of mental health concerns and the resources available not only in Calgary but within the province. So they're very and they're the people that the counselors on that phone all have clinical backgrounds in mental health. They're all mental health practitioners. So that's a good systems navigation hub. So Access Mental Health. Yeah.
I have a quick question about that. You know, if you find yourself referred somewhere and it's just not feeling like the right help or the right fit, what do you tell people about persisting in trying to find the help that will make a difference for them and their family?
So it's probably good to consider a frame of what's working, what's not working, and why do they think it's working or not working, and to take that information forward to a new service and to find out, where they can start so that they're not replicating what's already been tried. Um, for in the example of counseling, so if you've there's numerous counseling services in the city. So Calgary Family Therapy Center, Calgary Counseling, CARIA, Eastside Community Mental Health Services. There's private practitioners. So there's a wide variety of counseling services, grief and loss counseling. There's a wide variety of services for counseling offered, and being specific about the kinds of issue that you need support with, being specific about what you've tried, what has worked, what hasn't worked, can help the people that you're reaching out to identify whether that's a good match or whether they can find you a better service that's going to more match your needs. So it's really kind of just identifying what are your specific needs for yourself, for your family, and then coming with information to um, help talk to someone to organize that and put you on the right track.
Any other input on that, Laura or Cameron?
Sure. If you're going to go see a therapist, therapy is all about relationships. So, like Chris said, you could go and see therapist, counselor. I use those interchangeably. If you're not jiving with that person, that's not necessarily a you problem or a them problem. It just might not be a good fit. So I know that a lot of people feel like, well, it took a long time to get to see a therapist, so I should just take what I get, even though it's not working. No, you shouldn't. If you don't feel connected or that that person may be able to help you, there's absolutely nothing wrong in saying, like any other kind of service, yeah, this isn't for me. I'm gonna shop around a little bit because the person might tick all the boxes of the things that you're trying to work on, but you go and sit down with them and you're like, I don't know if I want to open up to this person. I'm not feeling it. Well, that's not going to be productive for you, them, the situation. So make sure it feels right for you.
Laura, do you have any thoughts on that as well? Any additional thoughts before we move on?
Just echoing what Chris and Cameron have said. I think Chris's point about thinking about if you feel like if it's not working for you, if you're having those feelings like something isn't right or it's not working, I think it's a great idea to think more critically about what exactly it is that's not working for you, like trying to make a list of the pros and cons and, you know, where is this not fitting or jiving for you? Because in that situation, it might be something like Cameron said that could be worked on in with the service provider if you bring it up with them, right? If you have a conversation with them about, hey, like this is how I'm feeling, these things aren't working for me. Maybe they will come back and be able to adjust things that ends up working for you or working better for you guys. Or if not, then that could be a sign to move on and look elsewhere. So I think that's some great advice.
I think
I
there's a
know.
mis
Also, go ahead.
I think there's a misconception or a misnomer that there's not enough access to mental health resources in Alberta, Canada community. I think what's actually lacking is a knowledge and awareness of what's available. It's not always clear where to go, but there's always some kind of resource somewhere for somebody who needs that specific, uh, you know, has a specific goal. So I think it's more the knowledge of where, have the awareness of where to go. And maybe that might take getting some advice or doing a bit of research and background work and consulting with people and reaching out. But that's the critical importance of being persistent and not giving up until you get an answer. So continuously searching for the answer you're looking for until you find the right person that can steer you in the right direction.
And I want to remind everybody, as we get closer to doing the Q&A towards the end of this webinar, please feel free to start entering some questions into the Q&A as things have come up for you. Before we get to that, I had sort of one last question about helping people who are trying to help others. And that is sort of what kinds of challenges have you noticed that family and friends can run into when trying to support somebody with mental health challenges?
When the people recognize that someone needs help and that person is not ready to receive it. That is always one of the biggest challenges. It's really hard to force therapy or treatment on people. It's the absolute worst way to try and make change happen, but it's gut wrenching when you see someone that you care about a great deal suffering and you know there are resources, but they're not ready for them yet. That's the main thing that comes up for me.
Yeah, I think there's more than one point in the family system that can intervene. So if a young person doesn't want to go for counseling or get support, the mother can go and get counseling and get support. Father can join, grandma can join in. Like and it doesn't matter who's accessing the support. Any one member of a family can intervene in a family issue or concern affecting a young person or anyone else who's struggling with a mental health challenge. So I think there's more than one way to accomplish a goal when it comes to healing and supporting mental health issues. And it's great when there's a whole team and everyone joins together, but sometimes it only takes one person to be the representative for the family, for the couple, for whoever to step forward and say we need a spotlight on this particular issue. And it's always that person. It's kind of the ambassador or the representative for the family or for the people that are needing the support, the community. And so that's where it kind of starts.
So, last question. What advice do you give people that are in that situation where they're either experiencing some, concern and frustration that they can't really act on because the person's not ready, or they are in the throes of taking care of someone who's struggling and having those hard days, etc. what can you tell people about the importance of being conscious of the impact that that's having on you as a family member or friend? And how do you advise people to respond to their own struggles around this? Do you want to get us started, Laura?
Yeah, for sure. So my mind right now is kind of going to the analogy of when on a plane, when there's no oxygen or there's some sort of emergency happening, the first thing that you're supposed to do is to put on your own oxygen mask first. Because if we don't, then how are we going to support others with putting their mask on? So I think in these situations, it's really important to be mindful of our own self care and our own battery and just kind of how much we're putting into trying to force this other person who might not want to go, despite the concerns that we have that might be very real. If there's that resistance there, then unfortunately, we cannot force them, and we're going to be just putting in more and more and more of ourselves until we're in a place where we actually aren't an appropriate person to be supporting anymore. So it's just as important, even though it might seem counterintuitive when we're, so focused on someone who's struggling. It's just as important to be focusing on how we're doing so that we can continue to be a positive support for the person who is struggling. So that's just the first thing that my mind is going to right now.
Mhm. Thank you so much. We have a few questions popping up now, and so I'd like to, thank both Joanna and Matthew for their questions. And we touched on this a little bit. Cameron, you even mentioned how heartbreaking it can be. What if the person doesn't want help?
Well, I think Laura said it best, really. You can't force people to take care of their mental health. You can't even force people necessarily to take care of their physical health. It's uh so that's a tricky situation to be in. But if you take care of yourself, because if someone around you is unwell, mentally, physically, or otherwise, and they're struggling also to take care of themselves and resistant to help, that's going to affect the mental health, the stress, the anxiety of the people that love and care about them. And so I would agree with Laura. You have to try to keep your own self as healthy as you can be so that you stay within that window of tolerance and that you're not getting pulled in so that if there's a point where that person does want help, you are there and you are able to be there for them with clear mind and clear focus. Easier said than done, but that's what I would suggest.
There's a really good question here, which it's conscious of the fact that mental health doesn't affect just one person because that person is part of a larger group somehow, whether it's a person in a family, a person in a workplace, or just even someone in our community influencing those around them. But if we're looking at just family, how do you help families that are dealing with mental health issues in terms of how it's impacting the whole family? And, you know, it has a trickle out effect.
So, as a therapist, I would want to identify the difference in perspective on what people see as the primary challenges within the family. Because someone might not want help because the help being offered is not matching with what they need. And so sometimes it's the question of defining what are the challenges, what do people agree or disagree about the challenges. So, for example, if a young person says, I'm being bullied at school, and that's why I'm isolating in my room, and I don't want to come out of my room because I don't want to go through that whole ordeal during the day. And the parents are trying to get their young person to school because that's good for their future. And so there's the obstacle there. So the question becomes, how can they best support them, knowing that they need to get to school because that's in their best interest, and what can they do to intervene with the bullying? So do they go to the principal and find out what's being done to address the bullying, or do they take their young person to a doctor to get them evaluated for symptoms of depression and isolation. Like it's all dependent on what is the young person, what are they asking for? What kind of help do they want? Maybe they just want their parents to have a one-to-one conversation with them about their distress and to validate some of their worries and concerns. And maybe that's enough of a bridge to get them back to school. But maybe they need something more intensive. Maybe they need to go to counseling. Maybe they need some kind of medication to offset certain factors. So it's complicated, but a lot of it's trying to identify what does help mean to people individually. Because sometimes we give the help and support that somebody doesn't need or want. So I always ask parents, what kind of support do you want from, or ask young people, what do you want? What kind of support do you want from your parents? What kind of support do you not want? What should they do versus what should they not do to best support you?
Thanks. And also, let's talk a little bit about family dynamics and the dynamics of a small group of people and how they're impacted by mental health. Say for example, supporting siblings within a home that has a child with some issues that are starting to impact them.
Well, in my line of work, most families that are involved with me are already quite fragmented. So I like to be open to the idea that if we're going to do something like family therapy, that could be just the parents or guardians for a session. It could be parents plus some of the children. It could be guardians plus some of the children. There's many different configurations that can happen, especially over time, if you're meeting with the same person for multiple meetings, that different parts of the story can have their own voice and a certain kind of configuration. Maybe it's just, I don't know, mom plus grandma plus two of the siblings, but that particular configuration means that the siblings maybe are a little more open and they talk a little bit more about that. But I also think outside of a therapy room, having some way for everyone to have a voice, because if someone in a family system is struggling with mental health, it's similar to what we were talking about earlier. It's going to draw all of you into that cyclone. It's going to try its darndest anyway. It's almost inevitable. You're sharing the same household and or just in close contact with each other throughout the days. So yeah.
Mhm. One question that's kind of related to that is how do you know when it's an individual problem or a family thing where, hey, maybe our whole family needs to go get some support, or maybe it's just an individual that gets support? Is that sometimes hard to differentiate?
Not for me. I don't really believe in individual problems. I mean, we are not individuals completely isolated from communities, from families, from people around us. Um, I just don't see it that way. We're all in a complex, interconnected web, and people are like humans. We are social creatures. We don't do well in complete isolation from others. So all issues of mental health are really family problems, community problems, societal problems, even. And so having that kind of lens, I don't really know how to see that as specifically individual problems.
So kind of in tandem with what Cameron's saying, I see it as a priority of focus. So, for example, in reference to your original question, when I look at a young person's life, like a child, what are their developmental needs? What are their trauma associated needs? And if there are any, and what are their unique needs that are unique to them as a person? So I kind of like to prioritize and differentiate what are their primary needs? What's the primary focus here? And then so that's the what, and that's what parents can focus on first. Okay, they can generate some information about that, write it down, and then you can identify the how. So how are we going to address these specific needs? And who is the best equipped? to do that? Should mom take, um, you know, young person to the clinic, or should mom get young person enrolled in a dance class to make them feel less socially isolated? Like what, so there's the what and then there's the how. And so like Cameron's saying, there's no problems exist within a more socio-cultural context and in a family context, and they don't exist in isolation. But you can intervene in any different point in the situation. As I was saying before, like anyone can be an advocate for the family, even the young person. And quite often young people protest what's going on in a family by acting out and showing bad behavior, or engaging in extreme behavior as a sign or signal that there's something wrong in the family that needs attention, and we need some help. And so it can happen it's not always, sometimes it can be messy. So there's warning signs, but it's the how do you want, like there's many ways of, I don't know what the metaphor would be, but there's many routes to the endpoint here.
Speaking of what you're just talking about, Chris, there's a comment in here from a person whose adult grandson has just moved in with her because he was unable to stay in his home with his parents, and that he's quite hard to live with. And she's kind of sounding a little bit close to the end of her rope, saying like, how hard do I try? How long do I continue doing this? So for folks that are finding that one individual is having a bit of an impact, or they're stepping in outside of someone's dynamic and trying to support a person, um, and they're getting close to that, how long do I keep doing this? What would you say to Joanna about that?
I would say that similar to what Laura said, if you love and care about this person, which of course you do, you're trying to help this person, of course you are. But if it's getting to the point where you can't identify your own oxygen mask on that plane or what's going on, then you actually risk not being as helpful. It's such a hard thing. Love and care is almost enough to help in any situation, but it might not be the only thing that's required in every situation. You have to be able to take a look at that and say, well, if someone's having a hard time helping themselves, or if you are working way harder than someone else at getting, some issue identified, um, as painful as it is, and I've had to say that to many families, you got to put your own mask on first. You won't be there in the future to be as helpful if you get drained of all of that energy at this exact moment when someone might not be as open to the help.
Talking about, oh, sorry, go ahead, Laura. I can tell that you're about to.
Yeah, I was just gonna add on that to respond to this individual like asking this question, I would suggest calling our line to talk about this further as well. This is an example of a call that we get a similar something similar almost every day. So you're not alone in going through this and having these thoughts about how long do I keep doing this and all the feelings associated with that. So I would invite and welcome you or anyone in a similar situation to give us a call and talk to one of our crisis counselors about this, because we're here to support with someone going through this, whether it just be venting about what's going on, that can be helpful a lot of the times, or whether it be problem solving and searching for other ideas in this circumstance as well. We can be a help in either of those ways.
Yeah, and I think those kinds of services provide clarity and points of focus and ways to prioritize, and in ways that can put your energy and efforts in the most effective area possible. Because quite often, as Cameron's pointing out, energy and effort is misdirected at a situation or an attempt to solve a problem that's pretty much wasted. And you can you can reverse that and reorganize that and put that in a more effective direction with certain guidance and support. And that's where how counseling services or crisis lines or just even a good supportive family member can clarify and prioritize and refocus a person in in a way that they can channel their energy and focus in a more productive way.
Okay, we've got 4 minutes left and a couple more questions. Let's see if we can get to both of them. One question about people from different cultural backgrounds are sometimes not as well versed in talking about mental health because it's just not part of where they come from in terms of admitting this is tough or acknowledging, mental health when that's just not a thing in their culture. What can you say to people who are from other backgrounds where talking about mental health and admitting to mental health issues aren't quite as common?
We didn't talk about stigma as much today, but I think one of the antidotes to that is understanding. So someone doesn't necessarily have to agree or endorse that mental health is, poor mental health is at work. Like a lot of it's just sort of in creating a dialogue of mutual understanding. So, what is the difference of perspective? Because it is about consensus building at the end of the day. Like if people have a disagreement about values or beliefs, or there's a clash of those things, then a lot of it's just drawing out the difference, understanding where people stand, and navigating from there. So you don't necessarily have to persuade people to change their beliefs or their perspective. It's more increasing the understanding so that people understand better how to respond or situate themselves within that tension.
And Laura, Eastside Mental Health, Community Mental Health Services, they actually are focused on offering services in different languages, aren't they?
Yep. So we do have a number, I believe, up to 10 different languages offered here through, we have therapists who speak different languages as well as crisis counselors. Just to name a few off the top of my head, there's Mandarin, Cantonese, Punjab, Hindi, um, I think Spanish. So there's more as well, but that's just a few. And of course, the mental health practitioners who speak those different languages wouldn't be available like every day of the week per se, but it would be something where you could call our crisis line because that's also the way that you would schedule a therapy session for yourself as well on our crisis line. And then our crisis counselors would be able to tell you the next availability of that practitioner who speaks the language that you're looking for.
Okay. Quick roundtable for this last minute. I've kind of saved this last question. It's how do you help someone who's just fearful of the stigma that Chris was referring to, and they've been keeping this to themselves for a while, and they're feeling quite private about it. What's a final piece of advice to people around just overcoming whatever it is that's holding them back from getting help, whether it's stigma or feelings of isolation? Quick piece of advice. Laura, why don't we start with you?
I think, um, are we talking about if you're the person who's reaching out for the first time or receiving the reach out?
The
For the
person who
first
you're
time.
trying to get help for, I think, is the, yeah.
Just really encouraging them that they are not alone and just validating that you understand it's scary and that it feels wrong or it feels all of the negative things, but just really validating those feelings for them, but also encouraging that they are not alone and this is the first step and you're so proud of them for taking that.
Okay, Cameron, Chris, any sort of last minute advice around just overcoming any fears that people have about getting help?
I think suffering is universal, and I think it takes a lot of courage to step out and step up to reach out, right, to get help. And so I recognize how hard that is, and it's not easy to be vulnerable and and let your guard down. And in some cases, you shouldn't be letting your guard down or being vulnerable. But at the end of the day, it does take courage, and I commend the people that do take that courageous step forward to access help, whether that's from a family member, a neighbor, or a service. I think it takes that sort of courageous first step.
Great. And Cameron, I know we're just over a minute over here. Did you want to wrap it up with anything or?
Sure. When I was young, I took swimming lessons, and you got these little badges, and you wanted to go into the deep end, but you had to start in the shallow end. First, you had to dip your toe in the water, then you had to get used to being in the water, then you learn how to swim in the shallow end, then you got this badge, that badge. Mental health is the same way. The person dipping their toe in the water is just as worthy of a celebration as someone who's finally ready to go into the deep end and really take a look at things. You have to start somewhere. Just start with your toe.
Okay, well, we'll stop things there. I'd like to thank everyone who attended, and special thanks to you, Laura and Cameron and Chris, for spending some time sharing with us today. Really, really appreciate you.
Thank you so much for having us.
Thank you, Nicole.
Thank you.